Okay, welcome. I'm so excited you're here. We're at the Openly Aging Collective. This month, we are talking about mental health as we age, which is a really important topic because as we age, things in our life can unexpectedly cause us to, feel a little more down or have a harder time, handling some of the emotions. So I'm so excited today to have Vidwans on. She is a clinical psychologist who works for Total Life, which is an online therapy group specializing in working with people 65 and older. So welcome, Preeti. I'm so excited you're here.
Thank you so much. I'm thrilled to be here.
Yeah. Well, why don't you tell us a little bit about yourself, your background, then we'll go from there.
Okay. So I have been practicing for about 15 plus years, a few, 15, we'll just say 15. And so I've worked with a lot of different populations, but a lot of my career has been with college students at UNC. But I recently transitioned a couple years ago to working with senior adults with Total Life, as you mentioned. So, and I'm enjoy it immensely. And so I was thrilled when you asked me to come and speak about this.
Well, I'm so excited we met and that it was the perfect opportunity. But tell me a little bit of why the switch from college to senior. Like, how did that happen?
Yes. So initially, it was really based on flexibility and schedule. So Total Life
Mhm.
is a telehealth company. So I can work remotely, and so that worked with kind of where I was in my life. And then
Mhm.
in terms of the population, I had worked some with older adults prior to working at UNC, but it wasn't a huge focus for me. But I have really enjoyed it, and I think it's just been something that there's some unique challenges that they face, and there's so much wisdom that they bring as well. And so I've just really enjoyed, working through some of the challenges, some of the things that they come in with, but then also kind of learning from them as well. And it's kind of I think a mutually beneficial relationship. So I'm happy to have made the
Absolutely.
switch, and I hope to continue to work with that population.
Awesome. Yeah, I always think too, as we get older, we go through so much stuff in our life that we've had to
Mhm.
overcome and we've had to deal with. Um, that it makes us very wise, obviously.
Yes.
But so tell us a little bit about what is different as we get older from a mental
Mhm.
health standpoint that maybe as we're younger or raising kids, we just might not have to deal with, or it doesn't become something that can overwhelm us. So, what are some of the big topics you hear from your clients?
So I think one is the fact that there is a loneliness and obviously grief piece that comes into play maybe more as we get older, and that we start to lose some of our supports.
Mm.
And so I think that that's very much present in a lot of in the work that I do. So grief, I guess, is one piece in terms of loss, and then loneliness just in terms of supports changing. And that could
Mhm.
look like moving into an independent facility or assisted living where your community changes,
Mhm.
or your adult children, your relationship with them changes. So the loneliness that can come from that, I think those are two separate things but related.
Mhm.
Loneliness and grief.
Yeah.
So there's that
100%.
piece, and then I think there's still stigma, obviously, in many populations around mental health, but particularly maybe around for this age group where it wasn't something that was even talked about or considered, or going to therapy wasn't something that people really yeah, again, considered maybe before. And so that can remain, some of those ideas or some of those kind of not even knowing what that could look like, can
Yeah.
persist. So I think that's a
Yeah.
piece maybe that comes into play too, as like we're kind of thinking about, like, well, how, when to ask for help, how to ask for help, what to even notice in terms of signs. So I think those are maybe some of the unique challenges that can kind of come up. And
Mhm.
I mean, in combination too, there's obviously the physical piece that changes as we get older, and physical health,
Oh, yeah.
right? Of course. And so that those two, mind body work in conjunction, as we know. So that can come into play, and just kind of
100%.
having that new identity of, like, okay, my body is different than it was, and what that means. So I think
Yeah.
those are probably some of the main concerns that I feel like come up with people.
Yeah. And in my work too, I sometimes see purpose, like what is my
Mhm,
new purpose? Because you mentioned
mhm.
the loneliness in regards to maybe your kids don't need you as much because they now, their kids are getting
Sure.
older.
Yes,
So your
absolutely.
role in your family has kind of changed and your
Yes.
role at work, you're not doing that
Mhm.
anymore. So I see that quite often too, is like the purposeful, like how do we keep,
Absolutely.
purpose?
Absolutely,
Yeah,
and finding that in a new way when your identity was maybe kind of really wrapped up in these other pieces for a long,
totally.
long
Yes.
time.
Yes, and I think you hit it on the head too, like acknowledging or, this generation that's aging right now didn't do therapy. It wasn't a
Mhm,
thing. So
mhm.
so tell us, some of the bigger signs you see or when you're talking to your clients, like, what are some of those subtle signs that maybe
Mhm,
people should be like, "Oh, that might be a
mhm.
little trick. Let me watch this piece of my mental health." So, from your experience, what could you give us
Yes.
as like little things to pay attention to?
Sure, yes. I think all as with anything, when there's a change, that's something to notice. So kind of where you were, and if you're feeling like something is different, that's and so that can be, I kind of think about when I talk to people 4 categories, cognitive, emotional, physical, and behavioral. So those are
Mhm,
kind of the ways, so cognitive can be concentration changes, behavioral can be eating more, sleeping less, isolating, emotionals like anxiety or sadness, and so it's like it's and physical, like the physical pain or muscle tension, or so I kind of, we have, like, when we do an intake, we think about those very clinically, I guess, but I think for people just to notice, like, what are those in their life.
I love that. So let's say that again. So say them slowly. So the first one is
So
yeah,
cognitive, so that
okay.
can be, changes in how you concentration, how you're thinking more slowly, things like
Yeah.
that.
I always tell people just because you start forgetting a thing here or there does not mean that it's going to be full on
Correct.
dementia. So don't
Yeah.
scare and don't say, like, don't hide it. It
Yes.
could be a sign, but sometimes people are so hesitant to like say I have brain fog or I'm losing, I'm not
Yes.
concentrating as much. And because they're so fearful that to say it out loud means
Means something much, much more. Yes.
right. Yes. And that's not necessarily true. It can be
Yes.
just life in general. Yep.
Yeah,
Yep.
no, so that's an important, and again, I think that change is important,
Mhm.
that there's something different than, maybe your baseline. So the second would be behavioral. So that could be, again, just, changes in eating, changes in sleeping, maybe
Mhm.
isolating more,
Mhm.
lashing out in a different, physically or verbally, or ways that you wouldn't,
Have
normally
done before.
behave.
Mhm.
Emotional, of course, we depression and sadness and anxiety,
Yeah.
and then
I
physical.
hear
So
that often that people are feeling more anxious as they get older. And
mhm,
I think for a lot of good reasons, they're anxious about what may come in the future. It's a
yes,
very unpredictable time in life.
mhm,
Anxious about finances,
mhm,
anxious about their health,
yes,
and anxious about the what mortality. I mean, we
yeah,
have to put the, elephant in the room as my logo is like, you're
yes,
facing feelings of mortality that you have never faced in another part of your life. So, yeah,
absolutely.
so the emotional piece is huge.
Yes, and again, I think a lot of this is just, recognizing that that's very normative, and kind of not,
Yeah,
beating yourself up around that. I think that's a really important piece too.
yeah.
And then the last one, physical. So physical changes. So again, muscle tension, headaches, stomach upset, things like that. That again, maybe are not,
Mhm.
that are different than before.
Right. And even if the physical doesn't, a lot of times we think physical as we get older, of course, our body is starting to be slower
Yes,
to, but
yes.
the problem is how it then leaks into, and correct me if I'm wrong, but leaks into mental health is if we don't really acknowledge it or take
Mhm,
ownership of it, our
mhm,
morale just really skips. We're
mhm.
not able to hang out with our grandchildren or,
Yes.
go on a vacation and go on the long walks in Paris. You're out of
Mhm,
breath or you're
mhm.
feeling unstable, and so that then leaks into that emotional piece.
Absolutely, and the guilt, and, and sadness around
Yeah.
what used to be, what could be, all those things, and so I often talk to clients about, like, what a new normal, I guess, a new kind of version of yourself and what that could look like. Like, how can you stay connected to your grandchildren in a different way? You may not be able to toss the ball with them, in the yard, but can you do that differently and still feel
Yeah.
meaningful, you know?
Awesome. All right. So I love that. So we have our four components that I don't know if you're aware, but my book on the four
Yes, the
pillars to
pillars.
keep
Yes.
control. So
Yes.
I love a framework. So I love that from a mental health standpoint, kind of being able to check those boxes like, okay, how am I doing in these areas? So say somebody says, hey, I am struggling, for obviously we're going to promote total life because you all are
Mhm.
all over the country, right? So,
Yeah.
and you're licensed can you work with
I'm
that people in every state?
Almost. So the way that it
Okay.
works is there's something called PsyPact, but, it's
Okay.
kind of 42, I believe it's 42 states. So most of the states in the
Okay.
country, and if, I'm not licensed in one, that there's another provider through Total Life that is. So they
Got
kinda cover
it. Okay.
the whole country in that
But
way.
if somebody is like, how do I even start this journey? Do you recommend they start with their doctor, or how do you recommend
Mhm.
somebody saying, okay, I'm struggling in one of these four components. I do want to take this step because to maintain independence is to be
Mhm.
proactive and take initiative. So how would you recommend somebody kind of take that next step?
That's a great question. So I think it can go a lot of different ways. Sometimes people feel really comfortable with their medical providers and their team. And so certainly starting there and getting their recommendations is important. Sometimes we get a lot of referrals from people who have used the service or, loved ones. So that's another, if you're going to someone, a loved one for support and then kind of asking them, or sometimes even the adult children will help make that first phone call or, another family member with them. But you can certainly go right to Total Life or another way to find the therapist. There's also Psychology Today. I don't know if you're familiar with that.com. So that is just
Mhm.
another, it's not specifically for seniors, but it's another resource to find a therapist. But yes, you can call Total Life directly, and all of our profiles are listed, and you can also see kind of who kind of specializes in
Yeah.
some things that you might want to work on.
Okay.
Or,
Awesome.
but
So why is it during the holidays maybe could be a time where some of this is more highlighted than
mhm.
maybe other times in the year? What is it about the holidays?
Yeah, I mean, I think one thing, well, is now in the age of social media is what we see. I mean, what we see is everybody, or what we think we see is everybody
Yeah.
gathering, with loved ones and having this kind of perfect, quote unquote perfect depiction of the holiday season. And so, which we all know is not based in reality. So
It's
there's
hard to
that.
remind ourselves of that.
Exactly, exactly. For all of us, I think
Yeah.
that comes across, but I think, particularly around the holidays, that happens, that there's the, the depictions in the media in terms of movies and Hallmark movies. Again, we're all familiar with that, but that can really create a sense of, just really worry, am I doing things right? What are my expectations? Am I living up to those? So I think that's, in some ways, we do a disservice to ourselves around the holidays, around all that. But so I think that's a piece of it. And, again, it starts earlier and earlier, it seems like the holiday season. And I think
Mhm,
that can
mhm.
definitely come up. Again, I think grief is something that, particularly comes up a lot around the holidays. And again, it's missing loved ones at that time, or maybe there's traditions that people
Mhm.
have done that they no longer can. So again, that can really be emphasized around the holidays. And again, I think it's this idea that people feel they should feel a certain way, and when they don't, there's a mismatch, and then they feel badly about themselves. So maybe
Yeah,
in any
that.
other time of the year, that mismatch is kind of highlighted or heightened.
Yeah. And I think you brought it up too. It's, when you spent a lifetime having maybe certain traditions and
Yes.
they've slowly kind of changed,
Mhm.
I think adjusting the expectation is important, and
Yes.
saying, okay, just because they change doesn't mean it's worse,
Bad. Mhm.
even though, but sometimes we need a little help with reframing how we're
Yes.
looking at things. And that's the point. But I do think, I mean, even for me, the last few years, our little Christmas has gotten smaller in our house. And
Mm.
I'm being very purposeful this year about like creating new traditions. I was kind of like,
Mhm.
oh, I want to bigger, we used to have these big Christmases and just life happens. And so I think it's the same kind. So it's really brought me to this topic personally. But then I think as we get older, it's a natural thing that
Yes.
happens is
Yeah.
our kids are with their kids and they're kind of all over the place, or so
Mhm.
these traditions we
Mhm.
held can be different, but you just have to be thoughtful about what are some traditions we can start, or what can we do to
Exactly.
make it feel
Exactly. Choosing what
more
you
as
want to keep and what you want to, to
yeah,
change. And I guess that's the flexibility part, again, what your expectations and how those can shift, and that's okay, you know.
yeah. What if somebody is, as we talked about, kind of never thought about therapy, or just doesn't,
Mhm.
can't even acknowledge, like think about sitting and talking with somebody?
Mhm.
How
Mhm.
can somebody like that maybe look at therapy different, or have
Mhm.
more of an open mind
Mhm.
to acknowledging, that, okay, I'm going to try this? What would you
Mhm.
recommend for somebody who just, it has never even been in their universe to think, but they really are starting to feel like they might need some support?
Yes, no, again, I think that comes up for a lot of people, but particularly around maybe people where that like you said, that's just
Mm,
never been something in there that they've thought about.
yeah.
I mean, I always say it's a lot about fit. And so you can, meet with somebody and see kind of how you feel and what your goals are and whether those, that person can kind of speak to that. And, I think maybe gone are the days of like laying on a couch and, and I'm sure
Yeah.
people still do that, but that's not kind of, the focus, I think certainly not at Total Life probably, but the focus now is more on, what do you want to see different in your life? And kind of
Mhm.
that's maybe the motivation and how can the therapist help you? And so, people the way I work is really some concrete strategies, support is really important, of course, but also some tools,
Mhm.
some concrete strategies, and I think that really resonates maybe with older people too, that they
Yeah.
really want something tangible, and so assigning homework between sessions and things like that,
Mhm.
where you can kind of see some movement. And of course, there's the validation and support, and that's really important too. But in the relationship, between therapist
Yeah.
and client.
If
Yeah.
somebody came to you that's loneliness is kind of their biggest thing, what would be some of those homework assignments? Or,
Mhm.
could you give us an example of some of those tangible things that maybe somebody listening who's not quite ready to take the leap, but could say, okay, maybe
Mhm.
here's something I can implement in my life to help me in this moment?
Yeah, so I really think about again what's important to them. Like what are they? What is do they enjoy working with kids? They enjoy working with animals. Do they want to play cards and bridge? Are they interested in a book club? So really thinking about how can you expand your social circle, and that could be through senior centers, and again depending on the area of the country, depending on some are more vibrant than others in terms of their senior center, and or community centers. But really seeing like what is of interest to you and how can you kind of get involved in that way. And again, it can be starting small, it can be starting with just attending a meetup or a group and seeing where you're at, and I think now there are so many ways to do that in person and online. So if somebody would like to start with the online and then kind of go from there, that's an option too. I think both can be valuable in different
Mhm.
ways. But yeah, it's really just I think figuring out for yourself what's helpful, and then taking that small, I guess, dipping your toe in there
Yeah.
and seeing, and maybe it's with doing that with somebody else or with a partner or a friend or helping you kind of bridge that gap a little bit to taking that step to doing that.
Yeah. Do you ever find that sometimes you're encouraging people to make not huge changes, but maybe starting to be more self-aware that maybe where they're living, or where,
Mhm.
their how their environment is set up is actually not going to support
Mhm.
their, feelings of purpose or feelings of connection? And that's a big conversation you have with people is,
Mhm.
you
Mhm.
know, sometimes we have to sit back and say, wow, maybe my current situation just isn't really working as I'm getting
Mhm.
older. Tell
Yes.
me a little bit about how that kind of conversation may go.
Yes. No, and again, I think it's just really just thinking like what's missing and kind of how to
Yeah.
get to that, and again, and sometimes people are living in like cold weather climates where, winters are harsh and you could be afraid of falling. And so does it make sense to consider moving somewhere else if you have, a community there, somebody there, even if you don't, what that could look like. So those really practical considerations as well. But
Yeah.
but yes, I think it's that same idea of thinking like if you could think about what you want and what's most important to you, and then how to kind of get there. And if that means, moving physically to a different place, or just kind of adding the supports or adding some things where you are, as
Yeah.
well.
Awesome. So, for you doing this work, what do you think is the most important thing you could share with the audience when it comes to general mental health as we age, but maybe specifically during the holidays? But just what kind of message would you want to share with people in regards to that for somebody who is in their 70s or older and is, obviously this is pertains to them?
Right, right. I mean, again, I think just being kind with yourself, and again, I think there's that mentality, especially for previous generations, of like pull yourself up by your bootstraps, But I think trying to go away from that and kind of saying like you can, it's okay to feel what you feel, and kind of putting that message out there, and then to certainly work on some solutions to it, and not just wallow in that, but to kind of to acknowledge that those feelings are real and really normative, and that there is support out there, and it can be,
Mhm.
again, it could be some trial and error with fit, and that happens for all providers, but there is support, and it could be, again, really useful for a lot of reasons.
Yeah. Awesome. So, one of the biggest takeaways I'm taking today from our
Mhm.
conversation is give yourself grace if
Yeah.
you're feeling a little down, if you're feeling a little
Mhm.
different, if you're feeling
Mhm.
just, ooh, does, life feels a little different right now.
Yeah. Mhm.
Acknowledge it, maybe
Yeah.
assess it based on the
Yes.
four,
Yep.
your cognitive, your behavior, your mobility, your physical, and your emotional.
Awesome. Yeah.
Yeah,
Mhm.
got him, I got him.
Yep.
Kind of assess that, and if there
Mhm.
is, and then do not hesitate to talk
Mhm.
with your doctor if you feel comfortable to say,
Mhm.
"Hey,"
Mhm.
because talking with somebody also doesn't mean you have this huge problem. It could be
Absolutely.
maybe 3 conversations with somebody gets you back
Mhm.
to where you need to go, and you're good to
Mhm.
go, but it just can maybe put some things in perspective. So either
Exactly.
talk to your doctor or go online and
Mhm.
find, so tell us, so it's Total Life Therapies,
Yeah.
correct?
Yeah, total life, and it's, again, completely telehealth, so that
Yeah,
also, obviously, again, for this population, that's convenient in the sense, like, you can do Zoom or you can do a phone call. Some people are more comfortable without the camera, with phone calls, so,
got it, yeah.
yeah, and
Okay,
it can be, again, anywhere in the country, so it really is not based on, where you are, but
awesome.
yes, and there's, many providers, and generally, obviously, you'd have to check and make sure insurance, your specific insurance plan, but insurance does cover it
And
for the most
Medicare
part.
specifically does, correct?
Yeah, so Medicare does, and many people have a supplemental as well. And again, this is really important to check with our, when you call, they will go over
Yeah,
the billing and the insurance and all that, because it's important to know. But yes, Medicare, we take Medicare, and that it often does cover the majority, of the services.
awesome. And
So.
especially if you probably start with your doctor, that does that sometimes help move the process
I
along if you
think
have a relationship, or no? Doesn't
No, I
matter?
mean, I think it doesn't,
Okay,
and more that's more of a
okay,
comfort thing, in terms of just if
okay,
you feel comfortable starting there, or having them kind of
yeah,
support you in your process, that's okay. That would be the benefit, I guess. So, and
okay.
like a lot of times people will meet for a couple times, feel, fine, and then they may come back in 6 months. So I think that's also important, is that you establish, first of all, that you did it, and establish a relationship with someone that you can then say, okay, I'm struggling again. Let me kind of talk to that person again. Yeah.
And that really goes back to the mission of this collective is all about proactiveness. So
Yes.
even
Yes.
if you're not feeling super down or you're not
Mhm.
sure if you're feeling
Mhm.
right, establishing a relationship with someone you
Yes.
trust. So if those feelings start really getting intensified, you say, "Hey,
Yes.
my therapist, I'm kind of starting to feel down. Can we just have another session?" So it's
Yes.
more about protecting your independence and protecting your
Mhm.
mental health than actually solving a problem with it,
Right.
is really the
Right.
way we need to look at it, probably, especially as we age. It's another
Absolutely.
tool in our toolbox,
Mhm.
because
Mhm.
as we age, we're more prone to some of these things.
Yes. Yeah.
So
Mhm.
awesome.
Yes.
Well, is there anything else that you think we need to know, or
Yeah, I think we covered, the highlights.
yeah.
Yes.
we wanted a quick burst, and I'm going to share your information. I'll share
Mhm.
this video with the community, and I'll have the Total Life
Perfect.
contact,
Mhm,
so they can
mhm,
reach out, schedule a time with you if it's something that they really
mhm.
think, and then of course, yep, and so they'll have that contact information.
Great,
So I
great.
really appreciate you doing this for us.
Of course.
It's great to have met you and to now have you in my toolbox as well for clients.
Yes.
And I appreciate what you're doing because I for the audience, when I first met Preeti, I was telling her that I have a hard time finding
Mhm,
therapists specifically for 65 and
mhm,
older. It is
mhm.
not as common to find, and I didn't know about Total Life, so I'm so excited now to know about Total Life. So I was very excited to see because it's not as common as you think it would be. So
Yes, yes. No, and
appreciate
likewise,
that.
I'm glad to know about the resources that you provide and what you do because I think,
Yeah,
again, these 2 things can work so well in tandem. So, I'm glad and
totally.
I'm here. So
Awesome. Well, thank you everybody for joining, and
Mhm.
I will see you